next presentation. Please welcome the next presentation entitled The Impacts of COVID-19 on the Management of Ankle Fractures and Their Outcomes, a Systematic Review, presented by Mr. Ashwin Chawla.
Good afternoon, ladies and gentlemen. My name is Ashwin Chawla, and today I will be presenting my research on the impacts of COVID-19 on the management of ankle fractures and their outcomes, a systematic review. So let's start with our introduction. We know that the COVID-19 outbreak has affected everyone globally, and each country has implemented different regulations in order to combat the pandemic. However, despite the pandemic, ankle fractures still continue to be a problem. So the aim of this review is to propose the impacts of COVID-19 on the management of ankle fractures and their outcomes. So coming into our methods, we did a systematic review using the PRISMA guidelines, where our search terms were ankle fracture and COVID on PubMed mainly, and our inclusion criteria was to see the management, outcome of treatments, other effects of COVID-19, and papers that were published in the English language. So we excluded papers that were case reports, other fractures, non-incidence or treatment-related parameters, and duplicates. So from our initial search, we got an initial paper of 29 papers. However, after screening through the abstract and the papers, we excluded 24, and we were left with 5 papers that were eligible for review. For these 5 papers, we also did a Newcastle-Ottawa Quality Assessment Scale to see the quality of evidence of each paper. So into our results, we had 2 studies that discussed that in decrease in incidence of ankle fractures during COVID-19. This is due to the implementation of restrictions in order to prevent the spread of the disease, leading to decreased events of ankle fractures. There were 2 studies that said that the surgery for ankle fractures during COVID-19 are prone to more complications or visits to the ER. There is a longer length of stay, and the time to surgery is increased due to crowded beds and managements of the hospital, and that there is a link between COVID-19 and the comorbidities in patients suffering from ankle fractures. So our Newcastle-Ottawa Quality Assessment Scale we got results at 5.4 out of 9, which shows moderate quality of evidence. So coming into our conclusion, we believe that COVID-19 pandemic has affected the management of ankle fractures and the outcomes in terms of negative impacts. We have COVID-19 positive patients that also have ankle fracture have had delayed time to surgery, increased hospital stay, and increased adverse effects from the surgery. So we recommend outpatient surgery to solve some of these problems, as it will shorten the waiting time and reduce the nosocomial infections. Thank you so much. Do you have any questions?
Thank you for your presentation. I would like to know about your inspiration, why you concerned about the ankle fracture.
So
yeah,
from our previous knowledge, we know that ankle fractures can usually be caused by either trauma or from elderly falling down. Since now we are during COVID-19 pandemic, there has been restrictions leading to some of the elderly being isolated alone, and they are having to be at home for a longer time, causing muscle weakness and being more prone to ankle fracture, which is why I wanted to know what are the outcomes of COVID-19 on ankle fracture, especially if they are also COVID-19 positive.
And what is the proper management for the elderly with ankle fracture? Surgery or just like do the conservative treatment?
For the current treatment, I am not 100% sure. However, I would believe it depends on case per case on how healthy the adult is. And I feel like during the COVID-19 pandemic, it would have to be more considerate whether they have any other comorbidities, such as like whether they have diabetes as well, or they are immunocompromised.
Okay, thank you.
I would like to ask you whether there could be a possibility of publication by us.
So In order to try to reduce our bias, we did try to have a Newcastle Ottawa quality assessment scale. However, I feel like in order to improve our paper or to further assess, we would like to do other funnel plots and having more reviewers to like come and screen our biases as well. And maybe in the future, we would also like to do a meta-analysis in order to prevent these biases as well.
So, what are your clinical recommendation for your finding?
So during the COVID-19 pandemic, when there were still lockdowns, our recommendation was to have outpatient surgery instead of inpatients. This would reduce the problems of having overcrowded beds, because having overcrowded beds would also would also overwork the hospitals. Apart from that, it will also, having outpatient will shorten the waiting time, and then we can send the patient home. Since they are already restricted and not allowed to leave home, we can try using maybe telemedicine to also follow up the patient to see their outcomes.
Thank you. Are there any more questions from our judges? In both online and on-site. Thank you.
Thank you.
Oh, excuse me. Are there any more questions from our judges and online?
So do we still have time?
Yes.
Yes, yes.
Okay, so I'm just interested in the two studies that you included in. They said that patients in the COVID era have prone to have complication after surgery. So did they explain why?
From the paper that I looked at, they did not explain why. However, they did say that the complications mainly included pain, and they had fever and rashes on the site of surgery after the surgery of the ankle fracture.
And did they have the comparison group? Or just only one arm?
They did have a comparison between COVID-19 positive and COVID-19 negative patients who had ankle fractures.
Thank you.
Thank you. Are there any more questions from our judges? Thank you.